Hi, everyone, and welcome back to Beyond the Dental Chair. I'm your host, Brittany Murphy, the Myo Hygienist, your guide to thinking outside the box, expanding your skill set, and making a bigger impact on your patient's overall health and wellness. Today, we are chatting about one of my absolute favorite topics, how to start incorporating Airway into your everyday hygiene appointments. Because here's the truth. You don't have to wait until you're fully certified or even until you take your first introductory to myofunctional therapy course to start making a difference. You can start right now, today, your very next patient in your chair, just by being more aware, more curious, and more intentional in your hygiene chair. So if you ever thought, I want to learn more about Airway, but I'm not really sure where to start, then this episode is for you. As hygienists, we spend more one-on-one time with patients than almost anyone else, not only in the dental office, but also in the medical field. We're not just scaling, we're observing habits, asking questions, and building trust, right? We are saving lives every single day. And that gives us a huge opportunity to start noticing signs of airway dysfunction and orofacial myofunctional disorders, also known as OMDs. So I want you to think about this. How many patients can you think of in your hygiene chair that come into your dental office that are mouth breathing while you're working? How many kids have open bites, forward tongues, tongue thrust swallowing patterns, can't keep their lips closed at rest? How many adults do you see that clench, grind their teeth, or complain about poor sleep or TMD issues? These aren't just habits. These are clues and they're screaming at you. We see them all day, every day. And once you know what to look for, you're going to start seeing them everywhere, even when you're just watching TV or you're walking, through an airport. So, what are OMDs? Essentially, dysfunction in the muscles of the face, the tongue, and the mouth. They're often linked to mouth breathing, improper tongue posture, swallowing difficulty, sometimes even speech delays, but not always because people learn to compensate. I want to talk about simple things that you can start observing literally today at your next appointment in the operatory. So, we're going to go through mouth breathing, tongue posture, lip seal, chewing and swallowing habits, and speech concerns or sleep concerns. When it comes to mouth breathing, observe your patient. Are their lips apart at rest? Now, of course, when we're working in their mouth, obviously their mouth is open. But when we're chatting with them, when we're catching up on, what else happened since that 3, 4, 6 month recall, when you're reviewing medical history, when you're, getting something ready, for your tray and the patient's in the chair, what does their posture look like? Can they comfortably breathe through their nose? You can ask them. You can ask to perform a minute or 3 minute breath test where, again, you're doing something, getting something ready in the operatory, and you're just asking them to breathe through their nose. Are they able to do this comfortably? Do they snore? Do they complain of poor sleep? Are they saying, something like, oh, I had to hit the snooze button this morning like 3 times. It's the story of my life. That's not normal, right? And here's the thing with sleep patients. They don't even know that they have poor sleep because they likely have had poor sleep their entire life. So they literally know no different. Tongue posture. You can ask them, where's your tongue resting right now inside your mouth? Is it up in the top, the roof of your mouth, middle of your mouth, bottom of your mouth? Do you feel it pushing forward against your teeth? Do you feel it pushing out towards your back teeth? That low forward or flat tongue posture, that is a airway red flag. A healthy, correct, optimal tongue posture is that tongue, the tip, middle, and back of the tongue, that anterior 2/3 body of the tongue, lightly suctioned in the roof of the mouth. Lip seal. Do the lips stay gently closed at rest? And not only that, but when they are closed, do they not have any compensation or strain in those perioral muscles? If they strain to keep their lips together, that's an indication of dysfunction. And you could observe this during your conversation, okay? Of course, again, during the actual prophy appointment itself, it's a little bit difficult. Again, when you're taking breaks and things like that, see what they do. Do the lips naturally come together at rest, which they should, or are they keeping their lips apart? Also, look for signs of chapped lips or dry lips. That can be an indication as well of a red flag. Chewing and swallowing habits. Do they chew on one side only? Do they sip water in unusual ways? Put a little water in a little, patient cup. Ask them to drink. Is that tongue coming forward to greet the cup? Are they, kind of puffing their cheeks or blowing up their cheeks on their swallow? Are they thrusting their tongue immediately when they're done? You can also spray some water in their mouth, get your fingers in there, ask them to swallow, and see what kind of pressures you're feeling against your fingers. Do they have to like reorganize their swallow multiple times? Are they still using a sippy cup? Do they only drink out of a straw? Are they a messy eater? Do they complain about, that they chew with their mouth open, or their child chews with their mouth open, or that their, area in front of them is very messy and there's food constantly all over the place? Speech or sleep concerns. You can ask simple, open-ended questions. How do you sleep? Is there any history of snoring, grinding, or sleep apnea? For speech, do you or your child have any speech history? Any history of seeing a speech therapist? Any speech concerns? These are quick questions, and these observations can really open the door to some very powerful, powerful referrals. Okay. So take what the history is of the child, of the parent, whoever it is that you're seeing. Listen, is there a lisp? Is there a tongue thrust? Is it just like unclear, like mumbling almost speech, or like a lot of jaw movement when they're speaking? Is there history of grinding, restless sleep? How about any behavioral concerns? Any history of or diagnosed ADHD in children and adults? So now that you've spotted some of these airway red flags, what do you do next? You don't need to diagnose. You just need to recognize, know what to recognize and what you're looking for, and make a referral. And here's a simple script that you can try. I noticed a few things that might be affecting how you breathe, sleep, or even how your teeth are shifting. I'd love to connect you with someone who can take a closer look at how your muscles and airway are working. It's simple, it's empowering, and it's non-threatening, right? We don't want to cause any nerves, any stress, anything like that in the patients because they're not going to do anything with that information. You can give them and spit out all this education, but if they're feeling like, sympathetic overtone, overdrive, they're going to completely shut down, okay? So you want to keep it simple. You want to keep it as non-invasive as you possibly can. And if you're in the process of becoming an oral facial myologist yourself, this is how you start to build your referral early. Okay. Starting these conversations now. You can self-refer in your dental operatory to yourself as an oral facial myologist. Of course, you want to make sure you check in with the doc and everything. They're okay with you doing that. But start building this referral system early. So by the time you finish your course, you have all these patients lined up to start seeing you. So before we wrap up, here are 3 things that you can start doing right now. I want you to add mouth breathing and tongue posture to your intraoral notes. Even if you're not treating yet, I want you to collect this data because this data matters. I want you to start educating your patients gently, holistically. A quick little comment like, did you know that breathing through your nose helps your jaw and face grow properly? That can go a really long way. Recommending a book to read, a podcast to listen to. And I really want you to connect with a myofunctional therapist in your area. Or you know what? You can reach out to me and I can give you the name of somebody that's a little bit more local to you. You want to know who you can refer to. You're spotting these signs. You're finding the dysfunction. Where are we sending them? You have the power. Remember, this airway, it starts in the operatory. We're looking at it all day, every day, and you have the power to start that simple, quick conversation that can spark the beginning of their journey that's going to completely change their trajectory, especially if it's a little child, or change their life as an adult. It is not about knowing everything. You don't have to know everything to get started. You just have to know a little bit. You just have to start noticing and putting your myo eyes on and observing and looking at things again, with your new Myo eyes, okay? So looking at things a little bit differently. And this is where intervention begins with you, with us as hygienists. So I want to thank you for always stepping beyond the dental chair. And if you have any questions, please feel free. You can follow me on at the Myo Hygienist. You can contact me through a form on our website. You can learn more about our myofunctional therapy courses at airwayhealthsolutions.com/myo and just keep spreading that awareness. As always, please reach out with any questions, any topic suggestions. I can come up with topic suggestions, but I really want the point of this is to create content that you're going to find useful and empowering. So if you loved this episode, share it with a fellow hygienist and don't forget to leave a review. It helps more dental hygienists like you find the show and truly feel inspired to go beyond the dental chair. So until next time, let's keep thinking beyond the dental chair. Take care and keep inspiring. Bye for now.